Start.
Good morning. Today's group discussion is on topic transcultural psychiatry presented by Dr. Tanya and moderated by Dr. Veena. What is a culture? Culture is defined as a set of meanings, norms, beliefs, values, and behavior patterns shared by a group of people. These values include social relationships, language, non-verbal expression of thought, emotional, religious beliefs, and rituals. It is learned, it can be passed, and helps in shaping and orienting the future. What are the components of culture? First is culture can be learned. It can be passed on from one generation to the next. Culture involves a set of words, behaviors, events, and symbols whose meanings have been tactically and objectively agreed upon by the culture group. Culture acts as a template to shape and orient future behaviors and perspectives within and between generations and to take account of and to take account of novel situations encountered by the group. It exists and evolves in a constant state of change, and it includes patterns of both subjective and objective components of human behavior. Now, cultural assessment. Culture, race, and ethnicity are concepts of crucial importance. Culture, race, and ethnicity are concepts of crucial importance in the clinical assessment of every patient. Culture influences the meanings that are given to the symptoms and impacts of interaction between the patient, his or her family members, the physician, and the healthcare system within which the latter operates. Culture plays a role in mental health and illness. Therefore, cultural assessment should be a component of psychiatric assessment. According to DSM-5, there is a cultural formulation wherein we found the cultural identity of an individual, cultural explanations of individual's illness, cultural factors related to psychosocial environment and level of functioning, cultural elements of the relationship between the individual and the clinician, and the overall cultural assessment for diagnosis and care. Historical aspects. In 1956 marked a new moment in psychiatry at a time when a number of prominent psychiatrists working in UK and Canada had developed similar and complementary theories about origin of mental disorder based on their experiences during World War II. Erich Wittkober, of German, Jewish, and British descent, he emigrated from Germany to the UK. While serving in the British Army, he studied the impact of stress, particularly related to the personality type. J.R. Rees, a military psychiatrist at the Tavistock, believed conflict to be the key etiological factor in mental disorder, evidenced by battle neurosis in frontline troops in World War II. In Canada, even Cameron observed that societal stress from a widespread effect of war resulted in mental distress in susceptible individuals. Freudian theory, culture may lead to intrapsychic conflict, altering the thought and behavior through primitive defense mechanisms, with resulting in psychological disturbances or mental illness. The personal and societal trauma of war prompted Wittkover to move to Canada to join Cameron, and after which transcultural psychiatry was born. Psychiatry viewed culture as a potential cause of mental illness that could be diagnosed and treated in a relatively short time frame of months to years. What is transcultural psychiatry? It deals with diagnosis, management of all psychiatric conditions as they reflect and are subjected to influence of cultural factor in psychosocial context. Culture contributing to psychopathology. Uh, what it is first is the pathogenic effects. Culture influence in the formation of a disorder. Example, Dhat and Koru. Pathoselective effect. Culture selecting selective coping patterns to deal with the stress, which is a mock attack in Malaysia. Pathoplastic effect, wherein culture modifies the clinical manifestation. An IPSS study showed the difference in patients of schizophrenia from India and Africa. Patho-elaborating effect, wherein culture elaborating the mental conditions into a unique nation. Example, trance and possession state. Patho-facilitative effects, wherein culture promotes the frequency of occurrences. And patho-reactive effects, culture shaping folk responses to clinical conditions. Example, faith healing of patient of schizophrenia and people attributing the illness as a result of black magic. What are the recent developments in global mental health? On 25th September 2015, 194 countries of the United Nations General Assembly, they adopted for 2030 Agenda of Sustainable Developmental Goals, which included mental health in goal number 3, ensuring healthy lives and promoting well-being for all at all ages with a reduction of suicide rate as a proposed outcome indicator. Cultural context and psychiatric disorders. First is schizophrenia. Some apparently psychotic experiences may be normal when viewed with a cultural concept. Example, delusions, wherein some believe in black magic, spirits, or demons. Hallucinations, seeing auras, the appearance of divine entities, hearing God's voice. Disorganized speech may actually reflect the local variations in language syntax or a lack of fluency in the language. In depression, in schizophrenia, some apparently psychotic symptoms may be normal when viewed within a cultural concept or context. Example, in delusions, there some people believe in black magic, spirits, or demons. In hallucinations, example, seeing auras, the appearance of divine entities, hearing God's voice. And disorganized speech may actually reflect the local variations in language syntax or a lack of fluency in the language. In depression, cultural expressions of depressive symptoms may vary across populations. In some cultures, there is a greater emphasis on somatic terms, example, nerves or headache in Mediterranean cultures, problems of heart in Middle East, imbalance, weakness, and tiredness in China and Asia. Equally difficult may be the interpretation of culturally normal explanations for symptom causation, which may appear delusion. Example, spirit possession or associated with somatic symptoms. OCD, religious and cultural beliefs strongly influence the content of obsessions and nature of compulsions. It is difficult to assess the significance of ritualistic behaviors unless the clinician has a knowledge of local customs. Somatization, it reflects the principal concerns in a population. Like worms and insects under the skin and scalp is common in Southeast Asia and Africa. Concern about semen loss in India and China, which is the most common cultural concept of distress. Conversion and dissociative disorders, more common in rural and isolated societies, may be culturally normal. Certain religious rituals involve alteration in consciousness, including a trance state and beliefs in spirit possession. Alcohol and substance misuse. Cultural factors heavily influence the availability, patterns of use, and attitudes, even the physiological or behavioral effects of alcohol and other substances. Low level of education, unemployment, and low social status are all associated with misuse of alcohol. In some populations like Japanese and Chinese, up to 50% may have the deficiency of aldehyde dehydrogenase or complete absence in 10% of people, which causes low rates of alcohol problems in these populations because of the unpleasant physiological effects. Other substances like use of hallucinogens and other drugs may be culturally acceptable when part of religious rituals like bhang in Shivratri. Culture-bound syndrome. Culture-bound or religious-specific syndromes comprise a wide range of disorders occurring in particular localities or ethnic groups, which are geographically isolated and culturally diverse. The term was coined by Yap in 1951 in his paper Mental Diseases Peculiar to Certain Cultures. These are the subtypes of culture-bound syndrome, which include startle reaction, example Lata, genital retraction, example Koro in India, sudden assault, example Amok, running, which includes Arctic hysteria, semen loss, which example is Dhat in India, food restriction, example anorexia nervosa, bulimia nervosa, and anorexia mirabilis, spirit possession, as in Bibane, and obsession with deceased, example ghost sickness, exhaustion, example neurasthenia. Now, what is Dhat? Dhat syndrome has been studied in South Asia, including India, rural areas of Nepal, Sri Lanka, and Bangladesh. It is rooted in Ayurvedic tradition about bodily production of semen as representing an end product of energy-demanding metabolism. It is a whitish discharge in urine assumed to be semen. This loss of semen is associated with somatic symptoms of weakness and exhaustion, severe anxiety, hypochondriasis, and sexual dysfunction. Similar syndrome is called Jaryan in India. Poro is the name suggests to shrink or referring to a tortoise, a popular word for penis. The fear or delusion that the genitals are retracting into the abdomen and the death will occur once this has happened. Elaborate measures may be taken to prevent the penis from retracting. Example, grasping of the genitals, herbal remedies, or fellatio. Predominantly in young single male in Asia and the Middle East, Thailand, Chinese, India, Singapore, and Israel. The female equivalent, fear or delusion that the labia or nipples are retracting, is known as katao in India. These are the rare. This is a very rare disorder. In India, mental health and psyche has been an area of exploration from Vedic period. There has been a description of human mind, its functioning, consciousness, and dynamics of human behavior. Presentation of symptoms in different cultures in India. In an article, Gautam and Kapoor reported that more patients from Muslim ethnic group presented with somatic complaints in South Indian population. Example, headache and vomiting. In North India, predominant somatic complaints were constipation and feeling of gas in abdomen. According to Kulhara and Chakrabarti, culture and schizophrenia and other psychotic disorders have a role in. According to Kulhara and Chakrabarti, culture and schizophrenia and other psychotic disorders are related. Thank you, sir.
Back to the third last slide. This katao is equivalent of what?
Katao is a female equivalent of Koro.
Please go to this. Click this.
That is the whole topic. Culture को first may exclude that culture is not the main reason for the illness, or is it the illness or cultural belief?
You understand? Yeah. Can you give an example?
So, like, there was a patient in OPD who believed that someone has done black magic on her, and all her family members believed the same, that there was some black magic in her family. So we can't diagnose her to be a paranoid schizophrenia because all her family members are included in the cultural belief of black magic. So first, we find out the corroborativeness of the history given by the patient, and then we
Very important. Very important. Oh, what is it? Is that shared by others in the same community? Then you believe that is that shared by others in this community as well? Is everyone has the same?
Any other person?
Maybe, what beliefs others would share?
They do not like people from other religions like come and do
Is it so? Because the Muslim can't enter to ashram. Actually, there are certain temples which do not allow. Those are couple of them. But local Muslim is coming into an ashram because I know a lot of ashrams in Hyderabad. It's not big.
Of course, if they come, but nobody is going to stop them at the gate from coming.
That
But
is
he
an
says
okay, so that is an avoidance of basically more of an more concrete religions, or I would say hardcore, the religions which have clashes. That is different. They are not avoiding. So they are avoiding harm or tendency that will harm. This is also shared.
तो हाँ ना हाँ अपवित्र हो जाएगा क्या भजन
Harm in the sense that the persecutory theme attached to it. This is also shared or not? Okay. Because there is a cultural religious divide. Fine, but if I'm a very hardcore Hindu religious person, I might not conform to another religion. Fine, but whether I am having this belief or my respect people are having this belief, they'll harm me. If this is shared, then it becomes culturally acceptable. Or this belief which the priest was having, this as a boundary, that there is a dislike, or they basically fade away those people. And when now this thing has started to crop up within that priest, not by others, there is a wrong. Basically, you need to go deep into phenomena, not assuming that they might be doing this. So assumption आएगा तो phenomenon. culture is very important. Because I think I'm very glad that Dr. Sanjeevani has joined this session. She has, I think, experience of working with 2 to 3 cultures. And I happen to work in a culture like Bihar and Jharkhand, and here and in South, where I did my PhD. So culture and understanding that cultural stuff is very important, very difficult until unless you spend time. It is not something, reading an article. You read an article, you'll know about the culture. You need to spend time, go into the roots. I still remember a day when we went to this what's that, gym puppet. So I thought that let us go to the villages, see how they live, what is their pattern, interact with the kids. So because those kids will be coming to us, I still remember a lady came here. The presumption was that she has psychosis. Ultimately turned out to be severely uncasted, post-COVID induced inflation of anxiety, and some cultural beliefs were shared which got exaggerated because of anxiety. Presenting as psychosis. Very poor response to antipsychotic. Ultimately, she got better with some supportive psychotherapy. Very mild antidepressants. So what appears might be having a lot of colors to it. That is why this seminar is important. Because and that is why आपका हम लोग जब कहते हैं कहीं से फोन आता है कि जी आप देखेंगे उड़ीसा का कोई पेशेंट आ गया या कोई बिहार से आया या साउथ से, so we always encourage them to go to a local psychiatrist because they probably will understand the psychopathology better than what we would do. But you have raised a very important. What is Sanjeevi? What is your point? Because you have worked in 2 to 3 different regions.
There are many things like this Dhar syndrome kind of thing. This is shared all over India. Even in Gujarat,
Pan-India.
Besides that, what I find very, on the field is position. Because position is something, we say it is dissociation or maybe something, but it is so much ingrained. Like even here also, a patient had come. I can remember that patient. She is a young female and she was having dissociative symptoms, regressive symptoms, talking like the girl. And then we started her antidepressants and and she improved. And later her husband came with her to the office. She was much better. But he told me that the house that we were living in, supposedly there was a small girl living there and she died or something. The parents were not sure she was living in her. And so now that girl is coming inside my white room. So I told her, how do you know all these things that happened before you came to this house? Then he was like, I asked the neighbors. Then I told him that your wife must have also asked him. Then he was like, no, she does not know. He was very adamant that she does not know. But I think somewhere or other she must have known. So now even the husband believes that there is this spirit of their young child. And also he gave me some other examples like they had gone to their house in UP and there also some priest told them and he did it hard too. So it is very difficult to, this culture, especially I don't know, in our culture it is so much ingrained, this ghost spirits and that position and dissociation is very difficult to explain. But she's still on antidepressants, thankfully. They are continuing treatment, but the husband is 100% convinced that it is a spirit. And also some other spirits he told me about spirits.
Extent of belief shared by the family or immediate society or the culture or the sect needs to be proven. Because our family, we belong to actually Mathura. There we have since childhood have had those jagrants. Dr. Tane must be knowing about it. Jagrants where Devi Ji will come and do predictions. So those are not understandable, culturally acceptable. And those people who have this privilege, they are actually more respectable, set to the society or the families. Everyone would go and touch their feet and have their blessings and no one want to offend them, which would probably propagate it. Only happening during Jagran. And we all share that this is Devi Ji, yes, this is in Jagran context, it is happening. If it occurs out of this, then it should be taken. And I'll tell you very interesting stuff. The one person in our family, which used to happen to him every Jagrant subsequently committed suicide a few years back. So I don't know whether he was more sensitive, subsequently he was prone for subsequent mental illness. We don't know. And one more important thing, Costa will agree with me. Costa, is it so? Am I wrong? Please point me. Does Bengal is a female dominant society? So I hope that you also follow that. So if some problem happens to a female figure in the family in Bengal, they will actually bring to their attention immediately. Vis-a-vis Uttarakhand, where the damage will occur to an extent, then only there. Because there it is more of a patriarchal mindset, and they will not immediately bring the patients. So we need to see the extent, where the neglect has happened. And all these things will come when we work in a culture and we actually try to apply this knowledge. One neurologist said to me, keep chakkar. She said to one of the presentations, there are a lot of terminologies used. If for Caesar they use chakkar in Uttarakhand. They'll never tell you Dora. They use chakkar. Never see chakkar as a what I do. Always go for chakkar matlab kya? Koi Caesar to nahi. So and he belongs to this place. We never used to do.
They come for population of the come for like 20 attendants and say देखो अस्पताल तो ठीक नहीं हुआ अब हम बाबा के पास in the whole village believe that बाबा के पास जाने के बाद it's all okay.
So you're talking about someone who is suffering from trans getting the money or a faith healing.
There are one or two such state pillars who induce that and who also get induced by themselves. And now they will either remedy for others in the village, those remedies which the doctors can't treat. They will never leave. Doctors say
because actually SMA what we did was in Ranchi, we actually did a seminar called all those people and educated them. Do whatever you want, also send them. So it became a very good referral pathway. So we need to educate them. We are not threatening your position. No one would want to threaten anyone's position if a financial aspect is involved. It is their bread and butter. But you can educate them, okay, they also pick out, okay, this person is going into some kind of a problem and establish a referral pathway and can be sent to us. Yes, yes, different culture, yes. I have read that, yes.
वहाँ पे उसको लेटने के लिए बोला था 6 घंटा उसके बाद बोल रहे हैं सब कुछ ठीक हो जाएगा 30 दिन ऐसे लेट जाओ ठीक हो जाएगा for many patients depression patients every patient they use like this and one more thing that is किसी को चोट हो गया तो बस में चोट हो गया अभी किसे सारा है उठाओ आ जाओ they will call me in front of everyone. There are a number of Babaji's are there.
Acha, was Nehru Baba. You're saying Nehru Baba. Those are basically planted. And I mean, when we are talking about religion, so psychiatry doesn't go into it. You can't challenge it. You'll be thrown out of it. One anti-psychiatric movement will come up, you challenge it. So we should not challenge it. So what do you call if someone says Donald Trump has, away from this topic, Donald Trump has this psychiatric disorder, that psychiatric disorder, or Modi ji has, or Yogi ji has. So are we supposed to?
No.
Why? Huh? Someone will come to some reporter and say, "ये आजकल anxiety बहुत हो रही है, CM साहब को lecture देते हुए, कुछ क्या disorder है?" ये सब चीजें. So this is known as Watergate rule. Watergate rules tells us not to actually any personalities who have some societal figure not to comment on their psychiatric psychiatric disorder or something. You want to ask him a question?
So should we explain people who believe that trance and possession state, they are normal or a psychiatric condition?
बताओ.
Scientific.
Now, what I do, motivation is something different. It will be difficult, it will be challenging at times. Motivation is like very high. So you have to sometimes step back. That's what I have experienced.
So because in body, everyone believes in these trance and possession
Yeah,
states.
try and they tell them that okay, you are wrong and you also give your own medications, your own suggestions, and it can also be. आप ये भी कर लो, कोई दिक्कत नहीं.
But they don't agree that they want to treat.
See, if they don't agree, why don't they
How many patients you have seen?
I'm not seeing that. I've talked to many people, so they believe this is a very normal thing here.
Normal in which context?
Normal.
Like आपको तो जागरण में लोगों को देखता है, but they believe कि अगर they see something wrong happening or something is happening, then also उनको तो देखता है. I was not well during lockdown. I had to go to and my maid was working out. She just came down. I got up, somebody banging on the door, and then my mom screamed, "Do not open the door." So her hair was open. She had taken up her slip on. Her legs were in the weird direction, and she banged on my door. The bathroom. And my parents are used to this because we have been living in this for a long time. So they went up, but the Gangachari to like उसके ऊपर लगाया, and then they took her up to the मंदिर वाला area. Then she was looked at my dad, अपने बेटे को बचा लो, and full dramatic. Yes. And she's been working with us for 2-3 years, and then they took her to the मंदिर, and then she went, and then she became normal. She's like a मेरे में देवता आ जाते हैं, बचपन से भाग कर आते हैं, कुछ भी पूरा देखते हैं तो आ जाते हैं.
So that is.
She came down to my room.
So that is what she said, what I shared, what you shared. This is culture. And you became better or worse?
I actually became better. Because after that, my dad is.
And hopefully you didn't share this with her. See, after you came, I became better.
Then my dad called the priest because he believed that there was something negative going on. Because she told him in that transmission state कि आपके घर में कुछ बुरा हुआ है. So he called the priest and we did a puja and all that. So the whole cultural thing, my dad also got influenced by. She was also into it, but and though my dog didn't let her enter my house. Dog never let her. Like, she approached me to enter my house.
So dog didn't share the Here we shared with schizophrenia in Africa and India. IPSS found a difference. What difference they could find? Just get back on the line after.
So this I
last,
this
but one segment.
so this
What difference actually? Culture modifying the clinical manifestation. So, what clinical manifestation? What difference does it make from Indian Africa? If you look into it, then it's
African India had some similar. African India were
So actually, Western countries are more auditory hallucinations, Indians are more visual.
no.
hallucinations are more in Indian Africa.
Yeah,
And
we
they
can
have delusions. They have delusions more than they are the first.
I remember this that they
no,
have
but see, matters a lot. That I saw a patient from US. She came. Yeah, I'm having bipolar 2. I'm having PTSD, childhood trauma, and I'm having fantastic personality. These are my treatments. Give me a prescription. Finished. No, कि कब तक चलेगा जिंदगी भर खाना है क्या करना है all those kind of questions. They're very clear. They accept it, and then they're ready to take help of it. But here it's a struggle, and that takes a lot of it. She started, I think, Camp Falls. She has just started a business 6 months. Initially, but he didn't like it.
We have a old school calendar. It also has some challenges. But we have any very good psychiatric videos, but you understand. We have really case of but ये से बोल रहा है अगले साल हम पूरा इंडिया कंप्लीट हो जाएगा, सेटल हो जाएगा.
2 साल पहले होने वाला था, बच गए.
So I think everyone believes in horoscopes and it's what they do.
Some of many of them have
Yes.
I think we have.
actually I'm very sorry, I was talking with them.
That is culture.
Very fast, sir. And I was only thing is that I would like this treatment part. Treatment part, you have to be in sync with their culture, you have to know their culture, and then treat. And as I told you earlier, challenges are never done. You will have negative counter-doctors. You will have what are they doing, man? They are acceptable. But then again, you have to go with the challenge. They will actually come. The thing is, those Babajis actually send what they do after 2 or 3 sittings. They don't, it is not improving. The psychosis mostly doesn't improve. So they actually send and they listen to their Babajis. So you have to have that like comfort zone for them. You are okay. Babaji ने जैसे बोला, आप ऐसे करो बस दवाई खाते रहो. This you have to keep in mind. Go and straight into the face.
Yes, so many patients come after they are being told by their faith leaders that go to a doctor.
And then, if you go and challenge them, they will not come. Okay. So you can only after you are accepting their views.
Cool.
Even the family doctors, engineers, whatever, they said that
he sees her, he's not afraid. He sees that I can see her at night, she's walking around, and I can see from the corner of my eyes. I said, okay, fine, let us coexist. So,
In challenge, I think the challenge. What is the genius?
mostly, I mean, cultural wrong thing, I don't know how it is in Western countries, but in India, it is a very
Very
not I think it's a part of life. And it is a problem only if it hinders our treatment. If it can coexist,
I think culture in our country is defined by the religions, the castes, and there are multiple layers of culture in which you also do. State boundaries, and then I think city boundaries. When you go to the interiors, then I don't know how much interiors, how cultural colorings are there, how many cultural colorings are there. So it is very difficult in our setup to actually have a generalized approach. Now what I've started to do is, let me meet you second or third time. Then I'll do some modifications. Actually, I'll know you much better by that time. So then the error comes here because we are not sure what the background in first interaction. So we'll be more sure when we subsequently interact. That is why we ask people to do those workups where you can actually assimilate all those information and actually bring to us. So that helps us in treating those patients. It's a challenge actually working very, very easy working in US, in European countries because they're very circumscribed, very well defined cultures. Here it's a challenge.
Right.
And you presented well. I think given the topic, cultural diversity.
well, yeah, what happened to change it? I don't know, something like, I mean, US, they're presenting well, but, proceeding with the बोलने का तरीका थोड़ा change करिए. In the sense, see, I'm not criticizing, but I'm just taking it as constructive.
Thank you.